thank you everyone for having us here today. Thank you to the Emids team for yet another phenomenal summit. Nothing like being the last panel and late, so we will try to make efficient use of your time. Very quickly, I'm Russ Thomas, Chief Executive Officer at Availity. I think we have a great topic today around creating health. You know, the underlying premise of the topic is around data. How do we identify and bring to the mainstream, you know, all the right data to help a person manage their health from end to end. But I really like fundamentally talking about it as something other than data. I just generally believe that, you know, there's a lot of data out there today. You know, there's certainly a lot of retrospective data in our health system. I think part of what you're here today is we are making significant moves towards more proactive data, things that can really help you manage your health on a day-to-day basis. But, you know, talking about it in the context of just data really doesn't, you know, do anything for me. I think we have to talk about it in the context of, you know, how do we leverage this data to create better health experiences, right? Not just healthcare and systemic experiences, but better, you know, better health for all of us, right? Because I think we would all agree that, you know, data in and of itself doesn't hold a lot of value unless we're doing something with it. So we have a phenomenal panel today of experts who have a tremendous amount of experience for many, many years in healthcare and are doing some really, really cool things with data in their new businesses to drive that total better healthcare experience, better healthcare outcomes. So let's work our way down. We'll start with Zane. A quick introduction, a little bit about what you're doing now.
Great. Zane Burke, CEO of Quantum Health, and we're the largest and starter of healthcare navigation. So what does that mean? Yeah. We bring together the plan sponsors, the clients, providers, and members to create a better healthcare experience. And we're doing it for 2.5 million members today for over 500 companies, and delivering a hard ROI and great net promoter scores and having good experience to kind of bring together the connective tissue between this clicks and mortar world that we're into.
Interesting. Fantastic. Dr. Schneider.
No one calls me doctor anymore. I'm Jenny Schneider. That's what my family and friends call me. I am Chief Executive Officer and co-founder of Homeward Health. And at Homeward, our mission is to re-architect the delivery of health and care in partnership with communities in rural America. And how we're doing that today is we enter as an in-network provider, and we partner with the health plans in the ecosystem. We take on responsibility for the total cost of care, so total capitation, value-based care. We deliver the care for those individuals, and we're starting in Medicare-eligible individuals.
Excellent. And then Ellen.
Sure, I'm Ellen Reilly, and I'm with Whoop, which is the coolest wearable out there and most accurate wearable. And we've obviously been successful in the consumer business, fitness, lots of Patrick Mahomes and Justin Thomas, but we really think there's a game changer for us in healthcare, working with life sciences organizations and payers and providers on really changing patient engagement, collecting data to really change and coach behavior change, and really change the game. I'm excited.
All right, so you kind of stepped into the fray here, Ellen, so I'll pick on you a little bit to start with, right? So Whoop, great company, right? I've wore Whoop forever. You know, I think probably we're all on this stage data junkies. We're talking about this a little bit, you know, backstage. I mean, you know, I convinced myself I needed to wear a continuous glucose monitor, so I've got that thing going. I got data feeding me all day long. But I think we're a little bit unique. So how do you think about what you're doing at Whoop and bringing that to, you know, not just the mainstream of people who are probably more prone or likely to live a healthy lifestyle, but how do we extend something like Whoop to drive better health outcomes, better data, better information, you know, across a much broader population than historically has really, you know, I would say cared about data?
So I think what we do differently is we coach people on what to do differently versus telling them what they did. So sleep. It will tell you, you know, based on your sleep debt that you've accrued, it's time to go to bed between now and here because it's going to affect your ability to really do your job or execute. We also have data. During COVID, we had the highest level of population data that we collected about the different vaccines and the impact. We have a study that's going to be published next week about the correlation between heart rate variability and the impact for early-term pregnancy. We've got some information on seeing early flare-ups that you know if you've got Crohn's, if your heart rate variability changes, that within a day you're going to have a flare-up. So this is an opportunity for people to manage their health. I think it was Bruce from Humana talked about people really taking control of their health and pushing that down to self-management. And we think that the opportunity is to collect this data and use tools to be able to people to look at the information and coach them on how they can manage their health better.
And you think that can be extended to a broader population?
Absolutely.
So Jenny, right, rural health, right? I mean, I'd shared with you guys backstage, I come from a big, Southern family. There were 13 brothers and sisters between my mom and dad. And when I think about how healthy they were very, very healthy, right? I mean, 1 or 2 doctors in town, the closest hospital probably 30, 40 miles away, but lived very, very healthy lifestyles. If I look at the health of my cousins, all 60 of us, right? I'm kind of the outlier that has really made a focus of staying healthy, and there's a lot of obesity and diabetes and congestive heart. I mean, there's just a lot of bad stuff happening in a population of people that came from very healthy stock. So I really love your perspective on, what's happened in that rural communities, and how do we, whether it's leveraging tools like that or data, how do you really get people focused back on, better healthcare?
Yeah, so thank you for the question. So I often say rural healthcare is really broken, not a little broken, but really broken, to the tune of 23% higher mortality if you live in a zip code with the last 3 digits that are designated as rural. So show of hands in here, who lives in a rural, small town America? A couple? So across the nation, it's 1 out of every 5 of us live in a rural, small town America. Independent of your own socioeconomic status, your mortality is 23% higher if that's your primary residence. And it's a big problem. So 1 in 5, when Zane and I were at Livongo, people used to think diabetes was huge. That was 30 million people, rural's 45 to 60 million. So this is a very big problem. Sort of underscoring, I think, a lot of the changes or a lot of the reasons for the high mortality rates are access to healthcare. So data is definitely important. 50% of people who live in rural America are unable to access a primary care doctor. The number of specialists in rural America is 1/8 the number in urban. And so we think a lot about data relative to how we can use data and help people monitor and care for themselves in a cycle where they don't have to drive 4 hours to a local hospital or a local provider. So again, for us, the data and the advent of technology that's deployed very thoughtfully is to increase access to healthcare in these rural markets.
Yeah. And do you think that there are sufficient incentives in that population to make the behavioral changes that need to be made?
I don't think the issue, there are certainly incentives for all of us, right? Those of us sitting on the stage, we probably, and in the audience too, we probably all made one bad choice this week relative to our health, like a donut, an extra cookie, skipped a run, whatever it was, right? So incentive is a part of it. But I think if you live somewhere where you can't access fresh food, where you can't access vaccinations, and you can't access basic medical care, it's really difficult to blame it all on motivation.
Yeah. So Zane, let me come to you, sort of following up on that topic, right? Because you're taking risk, right, for populations. How do you see data playing into that, and how do you leverage that data to manage your risk model, right? Because obviously you got a lot of skin in the game.
Well, what we're doing is taking the data, the claims data, the PBM data, the things that you would think of what we traditionally do, but we're actually taking the digital health information pieces, bringing those together in the life flow of members and on behalf of our clients. And our clients are sitting here with all these digital health point solutions, an average of 14 digital health solutions, not integrated in any fashion. The data is creating more islands of information. And so what we're doing is actually putting that together in a single platform and delivering that care up front. And then we're using artificial intelligence today, where we call it our real-time intercept, to engage earlier. And so using those data points, we can actually engage earlier with our members. We get 85% household engagement because it's a one place to come in the access to healthcare space, and we're using all the data that's being accumulated on that member, because none of us actually want to be identified by a condition, or as, I don't want to be a person with diabetes or hypertension. I just want to be Zane. I just want to go to my concert. I just want to go see my kids. That's what people do around healthcare. And so what we're fundamentally doing is bringing together those data to really help create a different kind of experience in the life flow of the member, but also to give things back to our clients so that they actually get the value out of those digital point health solutions, and even the provider. So for the first time, we are actually delivering data back to the provider to say, this person is eligible for Livongo but not using it. This person has Hinge, has kind of played with it, but hasn't really utilized that in full fashion and form. And at the same time, they just might have basic questions about their benefits and answer those kinds of things. So we're trying to bring together that whole ecosystem where we create that and the data is key towards doing that.
So one thing you talked about is engagement by household. And interesting, maybe anecdotal, but at Availity, we connect providers and health plans. That's what we've done for 20 years now, and we got 2 million active providers in the network, and we'll run 13 billion transactions through the network this year. Last week, one of our large Medicaid MCOs, so to us, a provider is you got a TIN, tax ID number, or an NPI, right? Last week, one of our large Medicaid providers dropped 30,000 new providers on us to implement. And when we looked at them, it was Meals on Wheels, behavioral, ramp builders, what I would call, we historically have called them atypicals, and I said, we're going to stop. My reaction was, this is a gift, right? Let's stop talking about them as atypicals and talk about them as the social fabric of the patient. And let's figure out how we support family members and, again, all these other folks who are providing care with data. And I'm just curious, when you talk about engaging a household, how you think about, what is that household, right? Is it just the patient, or is it much broader than that?
It's much broader, and I applaud what you're doing at Availity around bringing all these other pieces of the care system together, because they really are. In our world, whether it's the funeral services, is it the Boy Scouts to build the ramp? Those things matter, and it can be the spouse, it can be the significant other, all those elements around bringing that together. And so we're doing that same kind of thing today. Thanks so much.
Now you got the real mic.
I got a real mic.
Yeah. So Jenny, I think in the rural market, right, again, just sort of how I grew up, right? We took care of family members and grandma and everything else. I mean, is that social fabric an important part of how you think about driving a better rural care experience?
Yeah, it's critical. I would say beyond important, it's a critical factor. One is, trust is paramount in healthcare, and we have to build trust. Trust is earned, not given, and partnering with those in existence in the ecosystem is a large way, to create and collaborate and build the trust. I think the second is, as we go into rural markets, our mission is not to compete with healthcare providers in rural markets. Like, if the problem is there's not enough, competing is probably not the right answer for the solution. So fundamental to what we're doing is, in our mission statement, is with partnerships, with partners in communities. And we're doing that today. We've launched in Michigan with Priority Health, which is the health plan of Corewell Health, which is a combination of Beaumont Spectrum, which is the largest health system in the state of Michigan. We've also partnered with Rite Aid in terms of where we put our mobile vans so our members can access care when they're inconvenient in their workflow. So building trust, local community trust, is very important to us.
And do you guys think, let's talk about the economics of it, right? Because we have a very expensive system. It's going up in cost every year. When you're in selling to a prospective client, right? Whether it's a health insurer to take part of that population to take risk, or whether it's a health system, how do you think about an economic model that is going to work for them and also work for you?
So I can start with that. So our model is, we partner with health plans and bear the responsibility, the total risk for those individuals. And that's wonderful for health plans. One, we have the tools to actually deploy against the risk, right? So we're coming in as a provider. In rural America, fee-for-service does not work. Rural America is in a collapse. There's not enough patients. There's not enough infrastructure for individual docs to stay afloat in a fee-for-service, which is why they keep asking for higher rates, because fewer people are coming in. They're not incented to do the right thing. It's like, I say, my car mechanic, I've been there 4 times the last month. Every time I go back, I go home and I have something more expensive broken, right? My car mechanic, I'm funding college tuitions, right? So if you change that perspective and say, instead, we want to be part of the solution. We're going to come in and own the total cost of care and partner and get paid for the services that are needed to deliver care to these individuals. It's just flipping the system on its head.
Yeah. So when you hear this, right? I mean, 2 large firms that are taking that kind of risk. Where do you see digital health playing in that environment? And again, how do you get everyone, right, to wear the devices, use the devices? I mean, that's.
So it's interesting that we have a lot of use cases where people are putting it on their parents in palliative care to see whether they're still alive.
Really?
We have the ability to send data remotely, so we can pull the data off the strap and send a healthcare report to a loved one or a healthcare provider or a caregiver. And we think that's some of the dynamics that will allow people to die at home peacefully or wherever they are and be able to take the cost out of the system on that. Going back to my sharing of this study around early term birth, we think collecting that data, can you intervene? Can you change what's going to happen so you can take the costs out of the system? Spending the money to collect this data and coach or change or understand what's going on with the body, the HRV or your heart or your respiratory rate, and then can you take out costs so that you don't have to send a home health care aide into the house, you don't have to readmit somebody back into the hospital, and that's where we think the value is.
Yeah. So Jenny, you talked about this a little bit in our prep session that people don't most people, maybe zealots like us do, but most people don't manage to a number, right? They're managing to a better outcome. So given that, how do you really leverage the data coming through a variety of devices, whether it's Whoop, of course, which is great, or anything else to create a better patient experience and to really educate, particularly in rural market, I would say, educate people about what they need to do to improve their health outcomes?
Yeah, I think, I will hearken back to, I'm trained as an internal medicine doctor, and coming out of medical school, I thought my job was to tell everybody what the guidelines said and what the numbers were. Yep. And I realized very quickly, that didn't motivate anyone that I saw in the office. And so instead, if I'd ask questions like, how's your relationship with your partner? Or do you have a dog at home? And I'm thinking in the back of my head, man, if I can get this person to walk for 15 minutes, I can get their cholesterol down to meet guidelines, wean them off the statin, they'll save money, and I say, do you think your dog would like a walk after dinner? And all of a sudden, if you tap into something that people care about, they're more likely to take action. Very few of us care about what our cholesterol number is. Yeah. Right? Even me. I should know what mine is. I kind of don't care. I just want to live my life, right? And so I think the more we can understand and get to know people personally at a very individual level, this has been said multiple times, but you have to really spend time with people to understand what their pain points are, and that's sometimes difficult when we live very similar lives as leaders of healthcare companies. So my markets are rural. My family is from rural Minnesota. This is my family. These are my aunts and uncles and people that I know and that I love. And so I understand at a slightly different level around what those problems are and issues are for them to overcome. But once you do that, you understand people are people, and we're motivated by the things that we have passions about, and almost always it's relationship driven in some degree. Yeah. And if you can tap into that as a motivating factor, the outcomes are incredible.
So
can I comment on that?
Please, yeah, absolutely.
It's funny, I always tell my husband that I sleep better with the dog in the bed, and he's like, you're full of crap. There's no reason why that dog needs to be in the bed. And we have the ability to collect journal questions to see behaviors. And so every morning for the last 2 years, it asks me the question, did the dog sleep in the bed with you? And I can empirically share data with my husband proving that when the dog sleeps in the bed, my REM and deep sleep is off the charts. And so I think going back to understanding, is there going to be different behaviors and understanding what those things are, and then managing those to the relationship. You talk about the relationship side of it, is really getting to know yourself and what really impacts your life and your behavior, and how can you control that and change that.
That's funny because my wife says she sleeps better when I'm not in bed.
And that may be true.
So I'm gonna put a whoop band on her and see if that's really, or maybe put one on the dogs and see how they sleep.
Maybe the dog sleeps better.
Yeah. So that's very interesting, right? Because again, we know what we believe sort of anecdotally, but to be able to apply data to it, right, and to do that at scale, I think is a big part of the opportunity here. So Zane, one of the things I heard you say is the system is not really designed for the patient, right? It's designed for by providers and health plans, and really designed as a reactive system. So, as you think about the value of data and how you build a model that works, right? Because, again, fee-for-service, I completely, agree with Jenny, right? Fee-for-service model is just hard, right? Because providers know they're only going to get paid when somebody shows up at the doctor's office. When you think about it, how do you really apply that data to a model to deliver ROI and get results that reward patients and ultimately providers for being more proactive, in their care management, in their health?
So the key here, and I think all of us have said it, is it's got to be the personalized data, and we've got to create a trust element to this.
Yeah.
And you've got to find the points at which there's in something for everyone involved, so all the stakeholders involved. And that's one of the unique things about healthcare. There's actually more silos today than there ever has been. And in fact, companies like Jenny and I created at Livongo created more silos. And so it didn't mean it was a bad company. It just means we created, a better unique experience for persons with diabetes at that point in time. Unfortunately, that data wasn't anywhere integrated into the rest of the healthcare system. Right. And in fact, none of that data flowed to the provider in any way. And we've got to recognize that we've got to bring together all the stakeholders to make this meaningful. And it is that data that allows you to build trust along the way that Jenny spoke about, the relationship side of this. And so whether it's your Whoop, or whether it's what you're doing in your Livongo app, or what it's your connection you've made with a healthcare navigator along the way, it's a connection of a clicks and mortar world that is going to matter at the end of the day.
Yeah.
And how you create the connective tissue, I'm a big believer there is a massive opportunity to really create that connective tissue and be a platform for healthcare where you bring together all three of those components. And I think data is a massive part of that. But you're not going to get every single person. I know you'd love to have it be a Whoop on every single person. My mom is not going to go for that. Let me just tell you, my 89-year-old mom, she doesn't love. She's independent as hell, and she's never going to do that.
She's a tough lady.
She's a tough lady for sure. But in that sense, there are people that want that experience, and organizations like ours need to be able to reach out and take that experience and make that meaningful back in the experience. Right. And I think that's the key here is meet the person in their life flow, meet them where they are and the things that matter to them. Yeah. How do you create the trust and make a difference with the data in that side? And that's where I fundamentally believe that healthcare navigation has the potential to do that. I love what I'm seeing on stage, though. Healthcare is so complex. There's an opportunity for all of us to go make a huge difference.
So I worry, right? Maybe I'll turn it a little bit, not negative, but realistic. I worry that, so why, given that, why wouldn't every insurer in the country pay for anybody who wants a Whoop, right, to wear it and to use that to manage their data more effectively? And I worry that our current model is set up, we're going into open enrollment, right? Every year you readjust risk based upon what's happened in the past year, and you set premium based upon that, right? And we set our employee share based upon that. And by and large, I think the things we're talking about here, the way that we leverage data to create a healthier person over it happens over a longer term period of time. So I worry that What we're talking about is about driving long-term healthcare improvement when we have a system that is very annual in the way that it looks at healthcare cost. Would love your perspective on whether we can sort of bridge that divide a little bit and start incenting people with reimbursement policies and, frankly, benefits that really reward taking a longer-term view of your health.
From my perspective, it's got to be about ROI. There has to be a hard ROI in it, particularly in the environment that we're in and going to be currently in for some time period here. If we're not providing hard ROI, there's just not going to be that experience. In our business, the focus around ROI, at least a 2.5 to 1 return on every dollar that our clients spend with us, is how we approach the solutions that we put together.
Yep.
And so you have to think about how you're going to get to that hard ROI out of the box. And that's got to be part of that. Now, we've seen that where you can do that. You've got to create the right kind of schematics that, in terms of the benefit plan design, the connectivity, and the incentives on the other side for the member to participate as part of that, and then drive the value back to the clients.
And then bringing it back to this topic, and then you have the data, right?
And then you have
that you're capturing in real time and applying to really show that you're able to get that ROI.
That's right.
Yeah. Thoughts on that?
Yeah, I would say that in an ideal world, what you're describing as a problem would be the sole problem. Meaning, you'd say like, oh, are you investing short-term or long-term for healthcare outcomes? The reality is that we have massive inefficiencies in the system.
Yeah.
Massive inefficiencies that we've never solved for.
Great point.
And so I think that, some people talk about the exciting, boring businesses, these exciting businesses that are going to take out the inefficiencies. And so I think a lot about the power of technology to truly allow people to practice at the top of their licensure. I am shocked when we talk to our practitioners in the field. We had a nurse practitioner the other day say, I've never been allowed to do that work. And I'm like, really, why have you not? She's like, they just told me I couldn't. And it was middle at the top of her licensure. So our system's not optimized from an efficiency standpoint yet. If we do that, and then I think we can really kind of tackle that, are we making short-term or long-term investment issue?
That is an excellent point, because I believe, and it's kind of what our mantra is, right? I mean, you could look at Availity and say, well, that's not a very exciting business, right? Because all day, every day, we just work on administrative workflows and inefficiencies in the healthcare system and make hopefully our little impact on making it a better system. But to your point, if we can do two things: one, create dollars to turn around and invest in more prospective, more proactive healthcare management, and two, one of the problems I think we have is, the system was not designed for real-time data exchange, right? There's so much latency, whether it's in the way a claim is billed or, if we can continue to make improvements in creating a real-time transparent system, then I think you're absolutely right. You get back to, now we have some bandwidth and some capabilities to really leverage data to get to a much better, real-time kind of outcome and give us the kind of transparency we need for that caregiver, like you just described, to have a much more engaged conversation with the patient and practice at the top of their license.
So the challenge is, this topic is called creating health. Our healthcare model is sick care. Let's be honest. Yeah. It's a transactional of, you deal with people that have systemic and chronic diseases and need to be admitted for something or being dealt with, and it's not healthcare. We're not proactively saying, let's how we manage it until you have some chronic disease. I think you talked about the insurance side. It is a transactional business because an employer owns the healthcare in 50% of the business, then you've got Medicaid, and then you've got people that are self-insured. And I think as you see more and more of the evolution of where our population is, they're going to be they're going to be in a different employer. The 20-year-olds, they stay with the job for a year, 2 years. I mean, it's a transaction, and I think looking at population health and the payers really need to look at the larger perspective of longitudinal data to say, this creates value, whether the transaction is just for this year or you're going to be with this payer for 5 years.
Yeah. I think it's fascinating that a lot of what you both spoke about is each one of those is a health signal that if captured early can make a difference in the journey, and can make a difference both on the health side as well as the care side. So we know that if we engage early on, that we can change your trajectory. And so those engagements with when the provider reaches out to say benefits eligibility, that in healthcare today is a lost opportunity
Completely agree.
around a health signal today. That's something that you can capture today and say, hey, this person is about ready to go on a healthcare journey. We know that in the data that if somebody says the word specialist, that 94% of the time they're about ready to spend more than $10,000 on the journey. So if they have a conversation, we know 94% of the time this is about to be an expensive journey. To engage up front and to say, let's look at the providers in your network. Let's look at the right kind of site of care. Let's get these other places. On the health side, the ultimate goal is get it early. And again, this is the data early conversation. So to me, the way we create health is actually data early in the mix. And so, you have a lot of lost cutting room floor pieces in the world today.
We used to say at Availity, right? It's not the fact that it's not the eligibility response itself that matters. It's the fact that somebody is running that coverage determination, because you're right, they're about to enter the healthcare system. So that is I love the way you describe it. That is a signal event. How do we take that signal, apply data to it, right? Everything else we know about that patient, apply analytics to it to really be able to go, okay, let's get the team assembled here, right? And that's why I looked at all these atypicals, these social network providers that we just got, as a gift, because this is not just about reaching out and engaging, the specialist or even the primary care doc. It's, who's the assigned caregiver for my mother or whoever it may be. Let's get my brother, right, engaged in the process at the same time as well. And I completely agree and love the way you described it. Jenny, you were going to say something? I think a second ago. Okay, great.
My comment was I was hoping Zane was going to serenade us with the microphone. As the only non-boot wearer up here, I thought that was the privilege.
We did notice earlier, Zane, that you did not.
I was going to comment. You didn't get the memo. You're supposed to wear boots.
I'm probably the one that actually only owns multiple
you probably
boots.
Do.
I'm probably the one that has the most boots here.
Yeah. So I think we want to preserve a few minutes for questions, but any sort of, parting positive, hey, this is why I'm excited about the next, 10 years in healthcare.
I never appreciated sleep. I thought sleep was what you do when you die. But what we have found is in the data in sleep, you can see if you're sick, that's where it all comes out. Whether you have cancer or something's going on, your sleep is disrupted, whether it's your behavior or what's going on in your body. And I think collecting data such as sleep and heart rate and whatnot is really going to help people feed into how do they create health for themselves as well as for their family members. And understanding what's going on is really, I think, probably how many people have a wearable on?
How many people have more than one wearable on? There you go.
So,
Brad, of course.
Yeah.
So for me, I think the next 10 years are very exciting because I think we're finally about to start to exit fee-for-service world and truly enter into a value-based care component. And I think part of the reason we can do that is because of the advancements of smart technology, so that we can actually start to deploy things at scale to more vulnerable and harder to reach populations in a way that we couldn't before, where we were super urban focused and where fee-for-service could continue to be afloat in an urban environment. I think that's less true in health deserts. And I think that this crossover of technology rising up and the value-based care contracting or economic alignment is going to be really fun and exciting to watch.
Yeah.
I'm super excited about the next 10 years around actually creating a healthcare experience that doesn't suck. and I think we have the I think we have the opportunity for the first time to do that through the use of data, through navigation, through some other kinds of tools which are really experiential elements first, and it turns out doing the right thing actually can save money.
Yeah.
And I think that's kind of the fascinating dynamic as we look forward. And I think it'll also allow us to go take even a harder right towards, okay, we can't just have a digital app and pretend that's going to solve
change
the world. Change the world.
Yeah.
You're going to have to connect that digital app back to an actual service. And I think this connection back from a digital piece all the way through to the personal service piece, I think we're going to see those models come together in a much more meaningful way. And I think it's going to be a much, much better experience for all of us.
Yeah, and I think that we as humans, right? I started to say patients, but we shouldn't think about it like that. We as humans have some obligation, right, or hopefully at least some sense of desire to capture that data and make it available so that when we go into an experience with a provider, whoever that provider may be, we can have an informed conversation about it, right? Because that's where the real value, I think, can come from.
I think the comment early in one of the earlier sessions, we're all healthcare consumers.
Yeah.
We're not patients, we're healthcare consumers.
Yes. Okay, questions? I'm looking out at the audience. Any questions from the audience? Anybody? I see the mic. I don't see any hands up. Excellent. Thanks for the lights up there. I do have one, and I know everybody's ready to go home, but I have one question. I'll use an example. One of my colleagues, so here's the other side of the question, right? And looking at Brad made me think about it. There are people who capture too much data and can become alarmist about it. Not picking on you, but one of my colleagues, my head of HR, just put on a CGM, and I'm getting 5 calls a day from her. And she's the most healthy person you'll ever meet, right? My glucose is here, just sort of overreacting to it in general. Do you worry about that at all, right? That as we proliferate this data, I know we're not there yet, but as we proliferate data and make it more available, that we've really got to educate people on what the data means? Or are we so far from being overwhelmed with data that you're not worried about it yet?
So maybe I can start. My view here is that we're not even close to correct distribution. So I have type 1 diabetes. So to hear you say that, and I think to myself, all the people that I know in my type 1 diabetes ecosystem who can't afford and can't access a continuous glucose monitor, who deserve it and need it to prove outcomes to better health and reduce healthcare costs, that doesn't feel right. And so there's this world that there are some of us who, and I have lots and oodles of too much data, and then there's a whole world where people aren't getting nothing, or they're getting nothing. And so in my mind, I think the question isn't, are we going to overwhelm the healthcare ecosystem with too much data on quantified self? The question is, how do we make data accessible to the right people so that we can actually optimize the benefits of it?
Yeah, great point. Okay, other questions? Anybody? Everybody's ready to go see Miranda, I suspect. All right, well, thank you. Thank you all for joining us today. Great job, and thanks everyone for listening to us, and we'll see you all this evening.
Best boots ever.
That was fun.